Okay, great, thank you. So good afternoon, dear friends and colleagues. First of all, I would like to thank for your kind invitation to us. And I'm Guy Chen from the Chinese University of Hong Kong. And today I would like to share with you our work on myopia genetics and in Hong Kong Chinese, especially in children. These are my research funding related, and I have no commercial interest. As Pui mentioned just now, that myopia usually result from the elongation of the eyeball, leading to blurred distant images. And it is one of the most common eye disorders all over the world, especially in Asia. While in Hong Kong, as Pui mentioned just now, according to our latest study, myopia occurs in a large proportion of children, and over 90% of the university students are myopic, with 30% of them having high myopia. You know that high myopia is associated with a number of blinding complications. And therefore, with the high and increasing frequency of myopia, along with its blinding complications, we want to study myopia, of which, however, the causes and prevention methods has not been fully defined. Currently, some major environment risk factors have been identified for myopia, including reduced outdoor activities and increased linear work. Also, parental background also increased the risk of myopia, suggesting that genetic factors may also play a role. In fact, myopia is a complex disease resulting from the interaction of multiple genetic and environmental risk factors. Regarding the genetic models, there are Mendelian form and complex form of myopia. Based on different genetic patterns, we can adopt different approaches to identify the genetic factors of myopia, including the hypothesis-based approaches and also the hypothesis-free approaches, as listed here. As early as the 1990s, the first linkage locus of myopia had been identified, and so far, more than 20 linkage loci have been found. In a recent large-scale genome-wide association study, over 400 genetic loci have been identified. They collectively explain over 18% of the heritability of myopia, suggesting that there's still a large room for us to look for new myopic genes. Our group has been working on myopia for years in Chinese, and in earlier years, we mainly work on adult myopia. We conducted linkage analysis and identified new loci for myopia. Also, we conducted GWAS and identified a number of new genes and SNPs for high myopia in Chinese. And in this work, we identified 2 new genes. While in this GWAS, we identified another new gene, the ZFX1B gene. By working together with the CREAM consortium, we have identified a number of other new genes and loci for refractive error and myopia. However, this GWAS mainly targeted on high myopia, but we wanted to determine the roles of those genes in different severities of myopia. Therefore, we conducted the candidate SNP analysis in different grades of myopia, and we found that most of the genes were associated with higher grade myopia. These genes can be risk factors for myopia progression. However, we cannot test this hypothesis in adults. We therefore proceeded to work on myopia in children. There are a number of advantages in working on children, and the most important one could be that with the refractive error in children is still progressing. Therefore, we will be able to identify genes for myopia progression. Moreover, once we identify genes for ocular trace in children, we may be able to identify genes for eye diseases in an earlier age, facilitating us to earlier intervention. Hence, since 2015, we have been conducting the Hong Kong Children Eye Study, and up to now, we have screened and recruited over 35,000 children and their parents with the DNA samples collected for genetic analysis. We first identified that SNPs in the Win7b and RSPO1 genes were associated with X-link in children. And then we find that the ZC2H11B and BICC1 genes were associated mainly with the moderate and high myopia in children. Collectively, these findings may suggest that certain genes are associated with higher grade of myopia, indicating that they may be risk factors for myopia progression. When reviewing the literature, there was only one article about the genetics of myopia progression in children, which was reported more than 10 years ago by Professor Saw's group from Singapore. Therefore, we conducted a longitudinal study to investigate the new genetic markers for myopia progression in children. We recruited the subjects from the Hong Kong Children's Eye Study, and we performed psychoplegic refraction. In this study, we performed psychoplegic refraction for all children and collected their blood or buccal swab samples. Also, we collected detailed demographic and lifestyle data using detailed questionnaires. We followed up the children for 3 years, and this study involved over 1,000 children who have completed the 3-year follow-up. We selected SNPs from our previous studies and also the MET SNP from the Singaporean study. Here are the demographic data of the subjects. They are comparable to the overall subjects in the Hong Kong Children's Eye Study, suggesting that the cohort is representative. We find that 2 SNPs in the GJD2 and KCNQ5 genes were associated with fast myopia progression, and in contrast, the MET gene, which was reported by the Singapore group, was not associated with myopia progression in our cohort. We then divided the children by their progression rates and found that the GJD2 and ZFX1B genes to be associated with the fastest myopia progression. By studying the progression of the spherical equivalent and also the axial length, these genes are also associated with a positive. These genes also show the positive association. We then investigate whether the genes have additive effects by using polygenic risk scores and find that children having the highest score may have nearly 2-fold of increased risk of fast myopia progression. So in conclusion, this study identified 3 new genes as genetic risk factors for myopia progression in children. Their effect may be exerted via the axial elongation. Therefore, additional attention and proper intervention should be given to those children who carry the risk alleles of these genes. And this finding has been published in BJO recently. Apart from candidate gene analysis, we have also conducted GWAS on different children's eye traits. And also in our previous clinical trial, we have identified low-dose atropine was effective in controlling myopia progression in children. And we have done a GWAS on those children samples and identified 10 SNPs to be suggestively associated with myopia progression in children. And we are now validating these results, and we hope that we can share with you the updated results in our next international meeting. So finally, I would like to thank my team and colleagues we work very close to fight myopia, and also with a hope to identify new markers for myopia for early intervention. And also, I would like to also thank our colleagues in our society and also our college for all your support, and we join hands to fight myopia and in Hong Kong and all over the world. And finally, thank you very much for your attention. Thank you.
Thank you very much, Dr. Chen, for your presentation.